Chile Wire with Abe Baldonado.
Hey, y'all. Welcome back to the Chile Wire. This week, I'm excited because we are going to talk about one of the most important issues hurting our state right now, and that is medical malpractice. And with me today is my guest, Keon Ahghar, who's a dentist out of Roswell, and I am excited to introduce him, and I'm excited to have you on the show, man.
Yeah, man, I appreciate it.
We've had a lot of conversations just privately over the last few months.
Yeah.
Your interest and your passion on the medical malpractice issues that are surrounding our state, but it's great to have you on here. Before I let you, kind of share with us a little bit more who you are,
Yeah.
what you do. This is the first time on the Chile Wire.
Yeah.
I know this isn't your first time on a podcast.
Yeah.
But I got to ask you, red or green?
Ooh.
You're from Southern New Mexico,
No,
man.
so I'm gonna go against the Southern New Mexico grain because I'm from Northern New Mexico, but green chili, and I'll tell you why green chili. I love red chili. I love green chili. Smells like home.
Yeah.
That
the
when I
roasting
think about
of a
the
green
roast,
chili.
oh
Yeah.
man, it's like people everywhere else in the world. People think about like pumpkin spice lattes and stuff. Dude, I think about like walking into Albertsons and you got that roasting green chili outside. And sometimes I just like sit there and I just like watch it, and it's like, I'm from New Mexico. I born and raised here. Went to UNM, and I remember coming. I left for dental school and came back, and I remember that first fall coming back. I was like, man, I'm home. You know, when I was like, I think it was at like Smith's or something. And just that smell, dude, it's
You don't get it anywhere else.
No, you don't get
really
it anywhere else. And everybody else tries to, copy it and stuff. But man, that roasted green chili, and then it signals all the cool stuff. You got the balloon fiestas and all that kind of stuff. So man, it's, I have to go green just because green reminds me of home, So, and I love this place.
I agree. And it's the only one that you could really put on a tortilla with butter and maybe bologna and just have a really good morning or afternoon snack.
That's true. Yeah.
Well, Keon, tell us a little bit about yourself, the work that you do. I'm really excited to talk to you today about medical malpractice and some of the issues that are happening there.
Yeah.
And I think there's been a lot of emphasis on certain parts of medical malpractice, but there's some deeper issues with it that we're going to dive into today. But just want to give you a moment to introduce yourself, highlight some of the work that you're doing. But also, what's great today is this is someone who's actually impacted by our current medical malpractice laws.
Right. So I'm a dentist here in New Mexico. Like I said, I was born here in Albuquerque, raised here, went to high school here, went to UNM. Shout out to the UNM football team doing awesome things. But when I graduated from dental school, I came back, did my residency at UNM, and then ended up going to Roswell because I had job offers all over the country and stuff, but ended up going to Roswell really because it was one of the most underserved communities in the state.
Mm-hmm.
And ended up falling in love with the community. It's good people. And I see people, the type of my practice is primarily oral surgery. And so I see people every single day that drive 2+ hours to come see me, which is crazy. But I appreciate those people so much for trusting me with their care. And if I didn't see them, they would be driving 5 hours, if my partner didn't see them and the other doctors in our office. So a big thing for me was, we own a small family-owned practice. It's just me and my partner, and we started it, 2018, and really just with an emphasis on serving our community. We're one of the, we see patients with special needs. We do a lot of surgery, take call at the hospital. I mean, we do our best to serve our community, and I'll be honest, our community takes care of us too, and we have good people here in New Mexico, and I think, there's so much upside to New Mexico, and I catch myself. I'm not like I don't represent any groups. I represent me, but more than that, the reason why I care so much about this malpractice stuff is I represent my parents, my neighbors, my wife, my children, the kids in my kids' school and stuff, like my patients, my community. That I'm from here, and honestly, when I say that like living in New Mexico shouldn't be a death sentence, and in a lot of ways it's getting that way, I'm not exaggerating. It's really gotten to that point, and New Mexicans deserve, from me, I think they deserve better. I know they deserve better. And we'll get into I want to talk more about all this stuff, but it's I don't represent the physicians. I don't represent the dentists. To me, the reason why this is so important is because I represent my wife who had to leave the state for medical care after 2 years of 6-month wait list between specialists and getting, we're talking, it took us 2 years and we probably saw 5 specialists. And most of the time we were just waiting for tests, waiting for x-rays. It was devastating, and ended up going out of the state and ended up seeing 6 different specialists in 1 week,
Wow.
just, drove up I-25 to Denver and, 2 years of not being able to live her life was was able to be resolved and diagnosed properly and taken care of. I mean, she went to UNM, she went to, all over, nothing against UNM, but at the same time, it's like, it's just, I think New Mexicans deserve better. And that's who I represent. And that's who I want to champion, because I'm looking around and I'm seeing a wrong, and I think that if people knew what I knew, they would also be up in arms, and I'm not super eloquent. I'm not super smart. It's just one of those things that I look around and it's so obvious what I see, and so what I love to see, though, not that I love to see, but I'm happy to see, is it's getting more traction, right? Yeah. Because honestly, eventually the truth comes out, right? You can hide behind lies for a while, but eventually the truth comes out, and you're seeing that now. You're seeing, the Albuquerque Journal, I think today, came out with a study that I think 60%, it was 59% of people in Albuquerque are having a hard time getting into a doctor.
Yeah.
69 or 59%. That's almost 60%. They can't even go with a doctor or a specialist, right? That's not good for people, right? It's not good for people. And so I think it's, it's one of those things. And so, I could sit there and talk about all the problems, and I think the why is more important, right? I think talking about the why and stuff is really important. So like I said, I'm a hometown, I'm a, homie, but
Yeah.
hometown, New Mexican. And I just care about this because I'm watching my parents get older, and I worry about it.
Yeah,
right.
absolutely.
I have, a good friend of mine. His dad passed away, and he passed away on a wait list to be seen.
And that's not unusual right now. Where we're at. It's actually become more common, unfortunately.
Yeah. One of my best friends called me in December. His aunt had died, and she was on month 9 of a wait list to get into a cardiologist in Albuquerque. Had been to multiple ER visits, and literally had left one ER because she had waited so long to be seen that finally she was just tired, not feeling good, went home and died.
Heart attack.
She had. It was some kind of cardiovascular event, and it's just like, man, these are people's loved ones. That was someone's mother who now will never see her grandchildren. Her grandchildren will never know her because we couldn't get it together as a state. And I'm not saying, everybody's at fault. I know who's at fault, right? Yeah. But we need to hold these. We need to hold these people. We need to hold them accountable, because the thing is like our mothers and fathers and brothers and sisters should not be dying because of a profit system that makes money for a few, right?
And there it is, Keon. And I want to dive into that. Is why did we get here, and how did we get here?
Yeah.
Because there's 2 things there: why and how.
Right.
And I want to kind of have you kind of share, how did we get here? Why did we get here?
So I think real quick, just to kind of lay the land. So we're talking about malpractice. What is malpractice? Malpractice is, it's a mistake or an error that's made when you're trying to take care of someone, right? And it's human error. Now, sometimes malpractice is, the doctor's at fault, sure. But sometimes things happen, right? But the whole point of malpractice is to help make the patient whole when they are harmed, right? But to also understand that
you as a doctor don't disagree with.
Absolutely not. Yeah. No. So I sit on our state's anesthesia committee, right? And so we review cases and we discuss these things, and I see the cases that we need to take this person's license away. That's fine, and I strongly believe that, because if I see someone who's harming people and I think it's they just we need to or figure out a way to help them, but I also see so many cases where it's like it's interesting. There were cases that were presented that that the trial attorneys and their representatives love to talk about, that I actually know inside information about, that I can't talk about, but I know the whole story, and the whole story is not always told. It's always spun in a way. Now, I think malpractice is important because we need to, there's a balance, right? And I think that you should be able to practice in a way that your main focus is on care. It's not defensive medicine, right?
Right.
You should. So that's where that balance comes in. And now you're seeing more and more and more doctors who are not practicing that way. But going back to the malpractice, so malpractice, I believe, needs to exist, right? And it exists in every state in the country, right? We have malpractice. Doctors have malpractice insurance, and that's what that exists for, right? It exists in the situation where, God forbid, something happens and someone is harmed or whatever, and that family, that person needs to be taken care of, right?
Yeah.
That's what that's there for. And I'm not against malpractice at all. I think in malpractice is about accountability, but what has happened here is not that. Okay. When you look at what's happened here, there's something called punitive damages. Punitive damages are essentially, meant to punish. Punitive, means punish. So it's meant to punish conduct that's outright wrong, right? That is really egregious, and you hear these stories. But what's interesting is that you hear stories here and there, and yet more than 9 out of 10 lawsuits in New Mexico that are filed against doctors have punitive damages attached. So the crazy part about that is that 9 out of 10 cases where patients are harmed or allegedly harmed by a doctor, that doctor, punitive damages, for all intents and purposes, means they kind of intended to hurt that person. You're telling me that 9 out of 10 times the doctor gets sued, and the doctors are sued more here than anywhere else in the country. But you're telling me 9 out of 10 times in New Mexico, they're intentionally harming people. When you look at Texas, it's like less than 5% of punitive damage cases have punitive damages. In Arizona, it's even less. That's crazy.
Well, and I'm guessing that's due to our burden of proof is far lower.
Absolutely, yes.
Yes, for people to prove that, and which I think 9 out of 10 just shows that it's easy to show the burden of proof.
Well, so the system. So who made the system, right?
Trial lawyers.
Trial lawyers.
I'll say it.
Right, yeah, trial lawyers made it. So the thing is that the New Mexico has the lowest bar to allege punitive damages in the country. Okay, so what does that mean? So basically what has happened is the judges here have set it up, and the lawyers know, they know how to do it, that, we'll just let the jury decide, right? So it's interesting. I've had colleagues who've been sued for things, and I'm not going to get into the weeds of it, but they've been sued for things that it's just frivolous, right? Yeah. But then they're throwing all these other things on there. Well, it's a scare tactic, right? And what people don't really realize is, yes, malpractice might have a cap, and it's gone up and it's getting worse, or not getting larger, but punitive damages have no cap. Yeah. And also your malpractice insurance doesn't cover punitive damages, right? Because in other states, your malpractice insurance is there to protect, make right the wrongs, right? But punitive damages does not covered by that. Punitive damages in most states mean, man, that doctor must have been high. Yeah. He showed up drunk and did the surgery. He left. He was intentional. Yeah. He knew better and didn't do the right thing. Those are what that's really for. And yeah, that should be punished, right?
And at that point, they can go after your personal assets,
right? So that's but ultimately, what happens is that scares doctors away, right? The result is this fear that doctors have of being sued all the time, right? And they just want to take care of their people. They just want to take care of patients, right? And so, you don't want families thinking like, hey, well, this, you don't want the doctor going into the room saying, is this person going to sue me, right? You want that doctor going into the room and saying, I will do whatever I can to care for your loved one, right? I think it's really fascinating because for me, all that matters is patient care. All that matters is people, right? And this argument that keeps being made is that, that trial lawyers aren't
over profit.
Right. Yeah, oh my God, the whole patient over profit fiasco.
And that's the new tagline that they've used, right? Patients over profit. But Keon, not to interrupt here, I just there was something striking you said to me once, and you talked about what you mean to your community, and you had a very great way of putting it. And in rural New Mexico, like you said, if you had not been in your community, folks would probably have to travel to West Texas, out across state lines, 5 hours instead of 2 hours, which is still a long time. But there's an importance of the work that you do and what other doctors do to their communities. And we're losing that in New Mexico. And we're losing it in Albuquerque, which is an urban area, the largest population in all of New Mexico. And they're losing it here. I can't imagine what's happening to rural New Mexico because of our medical malpractice lawsuits. And I just want to note here, we have a graphic that we will share, but it shows that since the medical malpractice bill was initially passed, that the governors signed before, has actually shown that the influx of trial lawyers that have now come in and filed medical malpractice claims has skyrocketed. And we'll put that graph up for you all.
Well, because the reality is everything's based off incentives, right? You create a system where it benefits the trial attorneys, they're going to come here. I mean, I don't blame them. They're going to. But what I do think is it's the system that got us here, right? Yeah. And it's the
intended consequences.
It's the profiting at the expense of patients. Yeah. Because what's happening is, I think it's the thing I think is important to note is that I hear, like there was an article, I'm just going to say who it was. Brian Colon wrote a op-ed, basically saying, oh, it's not fair that the trial attorneys are being characterized in this cartoon about being greedy and basically laughing their way to the bank.
They're
but guess what? The families are not laughing their way to the bank after a funeral. Yeah. That's not it. If you really cared,
you can't put a price on someone's life.
No,
there's no price.
And the reality is like, if you really cared about putting patients first, right? That whole, patients over profit organization that turned out to be a total sham. If you're really all about putting patients first, then why are you leading to your patients losing access to care? Yeah. Why are you pushing the doctors out? Does that get them better care? Are they better because they don't have a specialist? Are they better because it's 9 months for my mom to get a colonoscopy, right? Is it better because I have a friend of mine in Silver City his dad's on a 12-month cardiology wait list, right? Is his life better because of that? No, and that's what the reality is that, fewer doctors means one, sicker people, right? The fact that it is 9 months for my mom to go get it scheduled for a colonoscopy, well, a lot can happen in 9 months, right? Yeah. We're not catching things early and treating them. We're now catching things too late, right? And so really what's happened is, when I read Brian Colon's article, or I've seen Peter Wirth, who's the, he's a senator, and Brian Colon used to be in politics, I guess, but he's a trial lawyer too. And when I see these guys talk about these things, it's like, we're fighting for victims. No, you're feeding off of them. Yeah, and that's really what it is.
And people don't realize they're taking 30 to 40% in attorney fees in New Mexico. And we had this conversation before. Yeah. It just doesn't stop at attorney fees.
No. It does. And that's the crazy part is that, it's not when I've talked to patients who have had malpractice settlements and whatever, the attorneys, they claim they take 30%, 40%. But the reality is there's all the other fees, the fees for the expert witnesses, the fees to fly them in from Iowa or, because that
a lot of out-of-state attorneys.
There's a lot of out-of-state attorneys. And so, and speaking to out-of-state attorneys, it's interesting. The irrefutable sign of what they're trying to do is everything that happened with the medical compacts. So a lot of people maybe don't understand that. But what happened was, the big beautiful bill happened, and one of the things that happened was they cut some of Medicaid out. Right now, whether you like that or not, the fact is it happened. Right, and so what happened is that they were like, well, the big fear was rural hospitals are going to be shut down over this. So we need federal money. We're going to allocate federal money. I think it was $50 billion to help support rural hospitals, like the hospital that serves all the hospitals outside of Albuquerque,
Yeah.
are rural hospitals.
Technically rural hospitals, yeah.
And so that money was allocated for that. Now, one of the criteria to get that money or to be eligible to receive more was to be part of a compact.
Yeah.
Okay.
And it ultimately, reading the One Big Beautiful Bill, it's a scoring system. So
Right,
you'll
yes,
get scored a
yes.
lot higher
If you're in a
if
compact.
you're part of the compact. And,
Right.
and a compact is, and correct me if I'm wrong, but ultimately you can receive telehealth from doctors in other states.
Right.
If you don't have a specialist or someone
Right.
locally, you can be seen at
Right.
least remotely from
Exactly.
another doctor.
Well, not only that, you can be seen remotely. Doctors can move here,
Mhm.
right? They don't have to apply for a license. They can literally just move in and they could move here next week,
Yeah.
And so,
So it's like reciprocity pretty much.
Yeah, exactly. You just can come here and
Mhm.
practice, or they can practice, from where they are and treat patients. Because a lot of stuff, if you're a rheumatologist or you're a certain type of cancer doctor, a lot of that stuff can be done. Some of the best in the world could be now practicing in New Mexico. We could bring the best doctors in in the United States to New Mexico. The governor, who I usually don't agree with, literally begged for this to go through in her special session. The whole point of the special session was to address the effects of the Big Beautiful Bill.
Yeah.
This is probably one of the biggest things, right? And even in her statements, she said there's too many trial attorneys in the Senate,
Yeah.
and they're probably not going to let this through. And guess what? They did not,
And,
right?
and she's also a lame duck governor, and I think we've seen, and we talked about this early on, is her decline in power. So
Right,
clearly,
right.
even as governor, she is the sole leader of the state. She's
Right.
the governor, but she doesn't even have influence or even enough clout to push her own party
To do the right
address-
thing.
Yeah, to do
Yeah.
the right thing. And again, and I got to ask, but even joining the compacts, and this is just something that I see from the outside. And again, I'm no medical expert, and that's why we have someone like you here who is actually impacted, and you can correct me if I'm wrong. But I also see, even if we were to join the compacts, I still look at New Mexico's medical malpractice laws because of our punitive damages, the occurrence definition,
Right.
which I don't think they would even still want to practice here because there's just so much risk.
Right.
So it's a potential fix, but it's just one variable.
Right.
There's so many other variables that need to be fixed alongside
Absolutely.
with it
Absolutely.
for doctors to feel comfortable to be here.
Well, yes, but I would also say that look, there's a lot of New Mexico. I mean, New Mexico has a lot of problems, right?
Mhm.
We have crime. We're first in crime, last in education, and now we're last in healthcare, right? We're also happen to be first in doctors getting sued. But
And we're also the
crime
only
is-
state that has saw a decline of doctors.
Right, and I think it's really
nationally.
important. So a lot of the arguments I keep seeing from these trial attorneys is like, well, every state is low on doctors. Yes, every state is. Well, most states are low on doctors. I can't say. I don't know if that's true or not. Every state, but I assume most places are low on doctors. But we're the only state that is losing doctors. We are hemorrhaging doctors, right? And so the reality is that at this point we got to stop the bleed.
Yeah.
I mean, we are literally bleeding doctors, and we need doctors. We don't need delays, right? Patients don't need delays in their healthcare. They need to be seen, right? But going back to the compact, okay, so yeah, I agree that like it was more as a next step to try to, and the thing is, it should have been a non-issue.
Yeah,
It's a non-issue.
nonpartisan issue.
This is not. They don't even have to
yeah.
write a bill. This is not like a bill. You literally just sign on the dotted line. Hey, yes,
Mm-hmm.
we're joining this compact. And guess who's also in the compact? 43 other states. Okay,
Yeah. But
Texas.
the trial lawyers want to redefine the compact, right? They
Right.
want to pass legislation and
Right.
and it's like there's already standard language
Right.
to make this.
You can't
compact
mess with it. And that's the interesting thing is that I saw them talk about that. They're like, oh, we need to really read through this. They have been trying to push a compact, from my understanding, for at least a decade, if not more. Right. It's not like this is some new topic. Right. This is like, hey, and to me, it's like common sense. How can you tell me, you look me in the eyes and say, I care about patients, and at the same time say, I don't want them to have access to the best physician who's only in New York City. Right. I don't want them to have a doctor from MD Anderson be able to consult on their case. Yeah. But I care about their safety. I care about these people. Right. It's baloney, right? But the reality is, the interesting thing is that unlike crime and education, malpractice is fixable in one day. Yeah. Now, will it recover that fast? No, it's not going to recover. I mean, the thing is, you bled all these, you lost a third of the doctors, right? they're not going to all rush back,
No.
right? It's going to take time. But if we don't start that now and we continue to bleed, what if we never lose another 30%? What if we lose 40%, 50%? I can tell you every doctor in New Mexico is thinking about it.
Yeah.
I have not run into a single doctor. I'm from here. You know, I have friends who are also born and raised here. Our families are here, and that's why we're here. But most of the doctors I know who are not from here, they've already left, right? Or they're planning on it. And I really think that the exodus that we've seen of doctors is only the beginning, right? And if you go, we are already last.
Yeah.
So now we're like I think you mentioned it. You know, we've already hit rock bottom. I don't think we've hit rock bottom. We haven't seen how bad it can actually get because it's just gonna keep getting worse and worse and worse. We're only a couple of years out of them. It's what's almost crazy to me is like even if you tried to do this, try to run all the doctors off, I don't think you could come up with a plan that would do it as effectively as has been done. You know,
But what does that mean? Like when we think about 40% of our states on Medicaid,
right?
we also have some of the worst poverty rates in our state. So I think about access to care. It's not even like if we bled doctors, we have communities that could advocate for themselves and fly to Houston to MD Anderson or to Phoenix to the Mayo Clinic. I mean, it's just not feasible for a lot of our families.
You know, living in New Mexico should not be a death sentence.
No,
it should not. You know, and that's I know that seems like just such a just kind of like
dark thing to say.
What a dark thing to say. It absolutely is true at this point. But the reality is like people deserve better. They do deserve better. My parents, your parents, my family, you know, my loved ones, my friends, their parents, they're my community, my patients, they deserve better, right? There are good doctors here. I know lots of good doctors that I would send my family to, my loved ones, my children.
And my dentist I've had my dentist since I was a kid and I still never leave. And people give me a hard time because I drive all the way from Albuquerque to Las Vegas, New Mexico, but he's a great dentist.
Yeah. you find a good doctor and you make a relationship with them. I think it's actually interesting in that study that they released in the Albuquerque Journal today. They said 75% of people, I think aged 18 to 35 can't get into healthcare.
Wow.
75%. So the people who are answering yes, that I can get access to primary care, it's kind of because they already have primary care.
Yeah.
The people who are now like, you know, people who are my age, you know, who are like, I need a doctor.
Maybe I need to get a doctor
maybe
now.
I should, yeah, you're like, okay,
I'm at that age now.
I'm at that age starting to see. They're not getting care, right? So then what's going to happen in 10 years where they still aren't getting care? Now you're going to see, you know, their mild blood pressure could be caught now, could have been treated, now it's not, right? I mean, those are the things. And so again, there are doctors here you want to stay. I'm one of them. You know, I have lots of friends who are from here or they live here and they love it here. You know, it's one of those things that's funny to me when the trial attorneys are sitting there being like, oh, the doctors are all bad. Most of these people literally got into it to help people.
Yeah.
Right. Most of the doctors I know just are passionate about taking care of people and helping people. And but they're overwhelmed, they're overworked, you know, and unless the system changes, they're going to leave and they won't be replaced. Yeah. And these are good doctors. I'm not talking bad doctors who should leave. I'm talking about the good ones. You know, Roswell's lost at least 3 doctors that in this summer that were great doctors who had been in the community for years, one of them for 30 years. And he is one of the best ER doctors I have ever encountered. I know I practice now, you know, I practice in Roswell. I used to take call at the hospital. If I knew that he was there, like I would literally, if I was going to take a loved one, be like, hey, I'm not going to say his name, but he's a great doctor. And I was like, if he's there, you're in good hands. Yeah. You have nothing to worry about.
But now we've done a disservice to the community because now they don't.
But he's, you know, and he got to a point where he was having a hard time getting insurance. Yeah. And it literally got to the point where he just the hospital was having a hard time just getting him malpractice insurance.
And that's one component, right? That the insurance premiums have skyrocketed for our doctors in our state.
Right.
But that's not just the only problem.
No.
That's one problem, but it's because of all these other factors in our state law that are saying, insurers are saying, nah, we don't want to touch you.
You know, so you know, not to harp on Brian Cullen, I don't even know the guy, but reading this article, it was just, you know, it's so infuriating because you're sitting there reading it and you say, oh, the problem isn't the trial attorneys. The problem is the private equity hospitals. And the problem is the malpractice insurance is
Well, that's
charging
just
too
it
much.
right there. It shows their hand. They want to sue big they want to bankrupt
Right.
hospitals. They want to go after the big bucks. And, just to share a little story with you, I was informed on a situation where there was a doctor in New Mexico who had a patient who had a significant tumor. Like it was very big and very uncomfortable. No one would touch it.
Yeah.
Like no doctor would touch it, but she was at risk of losing her life. And so one of the doctors took the risk, took it on, successfully removed the mass. Unfortunately, a tool was left during that procedure. They caught it instantly. So they got her back in, they removed it. Next thing you know, the hospital's being sued, nearly bankrupts a hospital in New Mexico.
Yes. Yeah.
And it was a rural community. And
Right.
had that hospital went under, could you imagine? And again, did an unfortunate thing happen? Yes. But was it at the magnitude the patient lived?
Right.
But they nearly bankrupt a hospital.
Right.
And that's a significant amount of money. And I'm curious to know how much money the patient even got, because as we talk about attorney fees and everything, I mean, who knows if, what she got was even what she felt like she needed to be whole.
Yeah. I think, in those cases, it's like one of those things that I think, it's hard to but you want to have those doctors who are not they're stressed about taking care of you. They're not stressed about being sued, right? That's what you want. You want doctors. And the other thing is like, so I sat there and I researched this. There are more neurosurgeons in Lubbock, Texas, which is population, 250,000. Don't quote me at that. It's somewhere in that range, than in the state of New Mexico.
Wow.
More neurosurgeons for a population of 250,000 people than for a population of 2 million. So you do get that brain tumor. You do get something happen. You have a stroke. Okay. These guys are overwhelmed. They're booked out 6 months, 9 months. I'm not saying they're not going to do a good job, but do you want the doctor that's just rushing and just trying? I mean, I have, like, for example, one of my friends, and I'm not saying that other professions don't see that. Every profession who gets overwhelmed sees that. But you're getting these doctors who are like, man, they're just trying to get through this wait list. Imagine you're sitting there and they're like, hey, we got a lady you're booked out 6 months, but this person's dying, right? They're just trying to get these people in, and they're just being overworked. But at the same time, you look at it, they don't have a whole network of people. The safety net is not that big. It's dwindling. It's going away. We don't even know if we really have a safety net at this point. Now it's just kind of like, hopefully someone grabs you before you hit the ground and die. Right. And so, again, I think that a lot of this is fixable. It's crime in New Mexico is, if you want to really tackle it, it would take a lot, right? It's you gotta deal with social economic issues. You got to deal with
rehabilitation.
You got to really get treatment, and you got to get people working. You got to get people jobs, and all those things are hard. Education, that's a bear to take on, but I think we should.
Yeah.
Right. But malpractice is literally, they could pass bills tomorrow. Yeah. They know what the problem is. They knew it when they signed it. When they implemented to say that we got here
thing
on accident and it was not on purpose. It just again, when you have a system that, that is, the punitive damages portion, for example, and the way that you can, I'm not getting all the definitions, all the stacking and stuff. Ultimately, the only people that are getting rich are the trial attorneys. This is their golden goose. This is their cash cow. It's not about patient.
It's not even local trial attorney.
No.
Some are, but a lot of them have sold out to out of state law firms that are now just kind of fly in and make a ton of money and
it's not really about. This is at this point not about protecting doctors, right? This is about protecting patients. It's about protecting families, and it's protecting the freedom to live in the state without dying. Yeah,
and there's research about. There's groups. Think New Mexico has done great work. Patients Pre-Meadow now is being led by a former doctor who
No, I don't think. She's
no.
she worked in
What?
law.
Oh, she
No,
was
yeah,
in law.
Patient Primero is an interesting group, like stuff like that. I mean, they are.
So she's
they're
so she's a lawyer.
She has experience in law. I don't really know her full background. She's not a medical background. I don't even know this person very well, but I see their posts and stuff, and I've talked to them a little bit. And these are people who literally just are so passionate about this that they are paying out of their pocket for all these things because they want change and they believe that the state can be better. I don't want to get into her information too much, but this is someone who literally has now dedicated her life to this cause. And she can talk to her own reasons, but she shared with me why. And because she had aging parents here who couldn't get care and she had to take them out of state. And it was such a hardship for her parents. You got aging, sick, elderly parents.
To just move them to another state.
Or not even move them temporarily just to get them care, right?
Just to get them care,
And that, I think, just resonates so much with her that she's like, I live here. I'm a patient here. I'm not. This fight is not doctors versus lawyers.
Right. This is you're hurting me, patients.
Yes, this is people. It's not about we need to support the doctors. That's not really what it is. The doctors are not like they don't need your support. The people who are harmed, the doctors can leave. The people can't.
Yeah.
Right. And eventually, you push out too many doctors. I mean, well, the other thing is happening now. My malpractice carrier has told me for the last 3 years that our state is on the chopping block.
Wow.
Right? They haven't dropped us yet, but they've told me, and my premiums keep going up, but the premiums are a cost of doing business. That doesn't bother me. I'm not like, oh, woe is me, I have to pay an extra couple thousand or whatever per year.
You expect that in
So it's
the career that you chose.
That would never chase me away. Yeah. Right? I love this place. I love my patients. I really do. I've been practicing long enough that I've seen the patients that were some of my first patients. They're still with me, and I know them. I hug them. I grieved with them when they've lost loved ones. I've held their hands when they were going through cancer treatments. These are people that I care about. That's who matters here, right? Yeah. That's who this is about. It's not about doctors versus lawyers, right? Yeah. It's not that at all. It's literally about one. I think justice. I think when I see a wrong and I see people profiting on the pain, the suffering, death of people in my state, I know that's wrong, right? I know that's wrong. And I don't want to stand for it. I'm not even a physician. I'm not even in these medical compacts. I'm not in this medical malpractice bill. I'm affected because I can be sued as a dentist, but like a lot of this fight is mostly around medical stuff, right?
Procedures.
Right. It's about the medical law, the laws that we've written here in New Mexico. It's one of those things that, like, again, it's all about putting patients first. And again, if I don't know, I sit there and I look at it and I'm like, if the trial attorneys really cared about patients, which they keep saying they do, right? Then they join the doctors in fixing the problem.
Yeah. Which they haven't even come to see. I was at the legislative task force hearing that was held last week on Monday before the special session, where they had folks from the hospital association, former patients, talking about these issues. Think New Mexico and the research that they've done, saying this is an issue that needs to be addressed quickly, and it needs to happen this week. And of course, it fell on deaf ears with the leadership in the roundhouse. But there's a group of people out there listening. But even then, there was a comment made where we invited trial attorneys to come here today, asked them to present.
Right.
And no one showed.
Right. Again, it's about the patients who can't get care in our system, right? And the system is broken. Mm-hmm. And the trial attorneys are fighting to keep it that way. When I see these op-eds, when I see Peter Worth blocking, it's one of those things they hear every year. We have brought these things forward and they get blocked every year, right? Every year we're fighting for our patients. But the reality is, and the truth is that, like, they're protecting their revenue. They're protecting a revenue model that bleeds healthcare, bleeds doctors, drives away good doctors, and makes it harder for patients to get care.
Yeah. And it's problematic because he is the majority leader of the state Senate who is a trial attorney.
Right. And it's one of the things that when I know people who called, his constituents called him. And it was interesting. Several came back to me and they're like, well, he said this is just the Republicans making up an issue. Well, first of all, Albuquerque Journal is not partisan.
Yeah.
New Mexico is not partisan. Patients Primero is not partisan. Yeah. Healthcare is not a partisan issue.
No.
access to doctors when you are sick is not partisan. It's not red. It's not blue.
Because
You know,
every single one of us is going to need it, regardless if you're
absolutely.
Democrat, Republican,
It does. It's not
black, blue,
right.
purple. Like, it doesn't matter.
Right.
Like, you are going to need access to high quality healthcare.
Yeah. And so, yeah, exactly. And so, you know, I see this, they just throw all these ideas out there. They throw all these things. Oh, it's this, it's that. It's okay. So this argument that he was making, oh, it's the Republicans are just trying to make this, it's not really a big issue. Arizona also doesn't have, has similar caps. Sure. But why aren't doctors fleeing the state and they're not getting sued at the rate that we're doing sued, right? Not even close, right? Well, because the system is there and it's a functioning system, right? So if our system was so good, why is it, if we're just like everybody else, then why are we last in every healthcare category? Yeah. Why are we first in doctor? We're the only state with doctors leaving. This idea that, like I said, Peter Worth, Joe Cervantes,
Liz Thompson,
all these, they go out there and say, oh, well, it's the corrupt private equity hospitals. I get it. Like I have a private practice that is family owned and run. Like literally, my wife helps out of the practice. My partner's husband helps out of the practice. It is a family practice that's there for our people. There is a problem in our healthcare system with private equity, right? Private equity means like big, giant organizations that are buying up hospitals. But why are they able to buy up so many hospitals in Mexico? Because all the doctors are fleeing, right? They're all leaving, or they don't want the liability. All these giant organizations, they can accept that liability, right? They only need to make a small profit margin, and to them, it's just a numbers game. And if they lose a bunch of money, it's a write-off. Like to that, so I'm not saying that the private the private equity hospitals and stuff are not a problem, but every state in the country has them, right? And then the other argument they make, oh, it's really the problem. They're not trial attorneys, not the med mal, it's the med mal insurance. So in the last session, I saw so many people say that. Well, every state in the country, every doctor in the country has med mal insurance. Yeah. If they're pointing fingers. The problem is really the bad hospitals that are owned by private equity, and the problem is really the health insurance or the medical malpractice insurance. Well, everybody has that. Yeah. So if everybody has it, then that's clearly not the problem. What makes us different? What makes us different is the system that they created, that they profit from, right? That is just not balanced, right? I'm not hoping for for the pendulum to swing all the other way and no more malpractice. No, man, I think that's good. I mean, I think there's a nice check and balance, but this system is clearly broken and they are doing everything they can to desperately hold on to this system that is just making them profits. Like you said, trial attorneys are flooding into the state. They're flying into the state on their private jets, and they're desperately holding on to this profit system in this industry that feeds off of, our health cases, the vulnerable people,
vulnerable communities. Absolutely.
And if we care about patients and we care about access, we care about safety, we care about reform, and not the system that rewards lawsuits over life-saving care, then we need to do something different. Because, like I said, I mean, like in Brian Cologne's article that you sent me, you talked about laughing all the way to the bank. I was like, again, that's not happening. These people they're burying their loved ones. Yeah. These people are not getting care. And again, it's not about the doctors. It's about people, and people, like I said, I'm a native New Mexican. I love this place. I love, I think we have plenty of problems. I mean, I think New Mexico is full of problems.
And every state has problems.
Everywhere has problems. But man, this is just one of those things that's just it's so undeniable. And the facts are just there. And every person who's trying to fight it, follow the money. Yeah. They're either trial attorneys, they're funded by the trial attorneys. It's, they have created the system, they know the game. All this stuff happened. It's interesting. A lot of the big changes happened in beginning of, February 2021. Well, what were all the doctors doing in February 2021? That was COVID. Yeah. They were all literally me at my office. I had a full on gas mask, face shield. We wore jackets that we had to throw away every day, disposable jackets because of all the COVID stuff. I wasn't engaged with the legislature. I was literally just trying to
Make it
practice,
and provide.
just provide care to get my patients in, provide care and do it safely and like not die from COVID, because we didn't know a lot. And I don't think we know a lot more now, but at the time, I mean, it was not like that. So kind of in the, it's almost like in the middle of the night, they noticed that, hey, we can get this through and no one's going to notice.
No one's gonna pay
and
attention.
our governor passed it, and that's the reality is now you see her say, we have a big problem. And I imagine she doesn't want her legacy to be the governor who destroyed healthcare for the benefit of the trial attorneys in New Mexico, but that is going to be her legacy, because the special session, we're not passing anything, again,
and we're coming up on a budget session. So
right.
she's going to have to give it a message for it to be germane in the session. And,
right.
Whether or not the Senate and some of the folks in the House are able to get it through. I mean, it's her last session. And so, and now we're also seeing, in the Albuquerque Journal a few weeks ago, there was an op-ed that said medical malpractice is going to be a litmus test for some of the Democratic candidates, and which Sam Bergman, Deb Haaland have all jumped in saying they support medical compacts, but they've not said anything about punitive damages or amending the definition of occurrence. Because first off, Sam Bergman is a trial attorney. He's not a district attorney. He's only done that for a couple of years now, but before that, he was a trial attorney. And
who's running his campaign?
The guy for
safety over profits, who is literally like clearly they were running around. They were pushing all these narratives. That's who's running his campaign. I mean, it's one of those things. That was that old saying that tell me who you are by showing me who you hang out with.
Yeah.
Well, there you go. If you don't know anything else about him, I don't know anything about Sam Bregman, but what I've seen his positions on this malpractice stuff shows me exactly who he represents. Yeah. He doesn't represent New Mexicans. He doesn't represent patients. He represents the trial attorneys, which he is one of them. Deb Haaland, I mean, she hasn't said anything.
Yeah.
That's the craziest part of it. She hasn't said anything. Okay, you come out and you say, oh yeah, like I am supporting compacts, but you haven't said anything regarding all the people who are dying in our community. Again, it's like, you sit there and you're like, man, a lot of these patients don't ever get a lawyer.
Right.
They get a funeral. Yeah. Their family gets a lawyer. Well, I would much rather have my loved ones than some settlement. Right.
Yeah. And there's no monetary figure that replaces a loved one at the end of the day. And there's no certain amount of money that you cannot replace a loved one.
But you also see, why are so many more lawyers coming here? Because as the system degrades, more errors happen. Yeah. The patients get sicker. Yeah. And eventually, I mean,
they start going after negligence. Oh, you didn't see this patient who was on a 10-month waiting list and now it's your fault. And you're
exactly.
Is it my fault?
No, but that's the thing is like, again, is it the doctor's faults for leaving? I don't think so. I think, but people can't leave. They have their homes here. You get, you're born and raised here and your whole family, you're not going to leave. But guess who can leave? The trial attorneys leave and they come and go. And guess who gets their health care in Washington, D.C.? Our governor, right? I'm sure a lot of the people, a lot of the trial attorneys also have enough money. Do they go out of state for all their health care? But guess who can't? It's the 40% of people on Medicaid, on Medicare, the 20% on Medicare. It's the people who, have HMOs who can't leave the state. I think that, and without getting too political, again, I think it's not red or blue. No. This is the healthcare is common sense. It's common sense, right? It's one of those things. Again, say you're a doctor and you're looking at coming to New Mexico, and New Mexico's worse in education. Okay, maybe you homeschool your kid. Okay, say you're a doctor and you want to come to New Mexico, and you're like, well, but there's a lot of crime. Okay, live in a gated community, fine. But you're a doctor in New Mexico. Guess what? You can't accept that. What you will not come here for is to lose everything and be under a microscope every day and possibly lose everything in your life and get wrapped up into a 10-year trial over something that you didn't really do anything wrong. But it really is. What's interesting is a lot of these punitive damages things that I've seen with colleagues of mine that have gone through it. Is they just add all these things on. Because now it's going to cost you so much more. Say there was something happened and there's a bad outcome. Well, if you just they say they're alleged that there was malpractice. Okay, there's one count of malpractice, right? Okay, you hire an attorney. Hey, they can kind of go back and forth, and you can kind of figure it out, right? But if they throw on 9 alleged punitive damages, well, suddenly that lawsuit costs 9 times as much to defend.
Yeah.
So what's happening? The insurance companies are coming in and settling. But I think this is crazy. Not only, the whole, again, that's why the 9 out of 10 cases have punitive damage test. But in New Mexico, we're the only state where malpractice insurance carriers lose money.
Yeah.
How long before they leave? How long before? Just like if you have a house and you're by a forest and the forest caught on fire 3 times and burned the house down, eventually the insurance company, they can't afford to keep rebuilding your house. They're just going to cut your coverage. Hey, we're not going to cover you.
I'll tell you, as someone whose family was impacted by the state's largest wildfire ever in history, just even seeing the trial attorneys that have come in and are reaping the benefits from all the folks that are not being made whole from their losses in the Hermit's Peak Calf Canyon fire.
Right.
I mean, attorneys are running all the way to the bank, and these are out-of-state attorneys from California that are coming in. But I've seen it myself directly, where hey, they're agreeing to give you this much, but after all the fees and everything, I mean, most of the people who have been harmed are not getting as much as they thought they were going to get and be made whole. And nothing gets your land back. All those trees are going to take generations to grow back, and replanting. But even seen it there where they've all flown in now to capitalize on the folks who have lost their land and livelihoods that were ranchers, farmers.
That's so sad.
It's unfortunate, man. But I appreciate folks like you who are bringing a voice to this, and I'm delighted that we were able to get on the podcast today to talk about this, because it's important to hear from people who are impacted, but also to hear that, hey, this isn't about me. And I think that is a very selfless thing of you to do, to say, this isn't about me, it's about my patients, it's about them having care. And people need to hear more of that, because I think every other doctor would tell you the same. This isn't really about me. I'm okay, but my patients aren't. When I have to put them on a wait list for months, like, I cannot see them because I'm the only professional or specialist who does this. And that to me right there is, you brought a great perspective. It's humanizing what is actually happening and who it's actually hurting. It's not doctors versus lawyers. No. It's patients who are being stuck in the middle that are paying the price. Right. And, I have to be a little facetious, but I would love to see a bill that lowered the caps on attorney fees in New Mexico, and also higher the caps on malpractice for attorneys, because guess what? You can sue your attorney for malpractice too. But I wonder what would happen if someone proposed a bill like that. There would be an outcry. What do you mean you want to hold us?
It's interesting, like doctors carry malpractice, real estate agents carry malpractice.
You have your E&O insurance.
Even insurance agents carry insurance, right? Yeah. Guess who doesn't? Lawyers. And it's interesting about the whole, you're talking about they fly in, so the loophole there is that if you are an out-of-state attorney and you find a local attorney they will, basically you can hire, right? So they hire new grads or whatnot, and then they fly their big, huge, multi-million-dollar law firm from Los Angeles. The guy who had that $400 million, it was a record, the highest lawsuit, the highest payout ever in the history of the country. Was from Iowa, and it's no surprise that the next year he gave over $400 million to safety over profits, which turned out to be just kind of a sham, basically just to put out lies, and it doesn't matter. But the lawyers can do it, right? The lawyers can come in here from out of state and practice here. There's loopholes around that. Guess who can't? Doctors. Yep. And it's the greatest irony is sitting there watching that happen. I remember a friend of mine told me that. So a friend of mine has to drive from his dad has to go to Silver City, from Silver City to El Paso. He has to go across the state border to consult with a doctor that specializes in what he's dealing with. Wow. Okay, because we don't have one here. Yeah. He's a good guy. And he's a person I've known a long time, and he's from New Mexico. He's a dentist, and and his dad is down in Silver City, and man, so while being on this wait list, specifically his dad, for his heart problems, he's got a nurse practitioner down there trying to help him, and she's like, I don't know what I'm doing. She's like, this is beyond me. We're trying to get you into the cardiologist, all these things. Well, during this process, he's lost his vision. Okay.
Oh, wow.
And he said the saddest thing, I mean, as a dad, he was like, I'll never see my grandchildren. And they're hoping, they're planning on starting a family and all this stuff. And he's just like, they waited so long to treat his high blood pressure and get him the care he needed that he can't see anymore. And my friend told me that, and I just like, I'm getting teary-eyed just thinking about it. But it's knowing the relationship my dad has with my children, that's heartbreaking, you know? And so, and that was, again, you know, the person that was there, from what he told me, you know, left the state. It was like the only person down there that was doing that, just, you know, up and, you know, just left and was like, I'm not doing this anymore. I'm going to go to greener pastures where it's safer for me to practice. You know, it's one of those things that it's not like it's just one of those things. It's like, if you do any job, and it's like, well, not only can I make more money in another state, but, you know, the education's better, there's less crime, and I don't risk losing my entire livelihood. Like, you would leave too. I mean, I've had people tell me, like, why are you here? Or
you'd even at least consider it.
Right. Yeah. You start thinking about it. I mean, you just do. Well, the reason I'm here is because my family's here. You know, I want my kids to have a close relationship with my parents and my family. And that's part of being a New Mexican. You know, I love it here. I don't know anywhere else.
Well, New Mexico's gorgeous, man. We have a beautiful state.
There's nowhere in the country that's better weather year round than New Mexico. You know, you have some of the best hiking, outdoors, hunting, fishing, you know, amazing food, really beautiful, you know, just, it's a beautiful state. And there's good people here. And like I said, I think they deserve better. I sit there and I wonder, like, should I move my parents out of the state, you know, as they get older? My parents are in good health, and that, you know, but I'm watching them get put on wait lists now to see the specialists they need to see. You know, and it's not fair. And it makes me so worried for them. And I don't want to look back in 10 years and be like, man, I knew better.
Yeah.
And I didn't tell my dad or my parents that they should move somewhere with better healthcare, and something bad happens. Right. And, you know, so what do? You get involved, you know, you start calling your legislators, you start calling your senators, you get involved with Patients Primero, you go get involved with Think New Mexico. Yeah. I mean, and talk to people. I mean, what do you do? I mean, I'm not a politician. I don't have some magic wand. I think
the importance is we have dialogue. We have a conversation. Right, I mean, even just like we're doing here on the Chile Wire, we just have a open, honest conversation about, hey, here's an issue that's really hurting us. And you may not feel like you're impacted yet, but you will be. And your parents, your loved ones, anyone that you think of will be impacted by this at some point. Maybe not right now in this instance. And, you know, I think we talked about, like, when you're young, man, you don't think about a lot of this stuff, right? Like, you don't think about going to the doctor. No. You know, you think you're immortal in a way. You're like, oh, I'm fine. I'm healthy. I'm only 21 years old. I'm good. Until you're not. And until your family is not, and they need that care. And so I couldn't agree with you more. It's important for us to have this conversation, but it's important for us to get involved. It's important for us to reach out to our legislators and encourage others to stand up and speak their minds. And Keon, I got to say, I'm grateful for you. I'm happy that we got to know each other. We got connected, and I am excited about what's to come, because I think there is going to be a change. I think there is going to be an opportunity where New Mexico thrives and actually sees this through, that we make changes to our medical malpractices. And we see a change where, hopefully, like you said, it's not going to be an overnight fix where doctors are just going to flood in tomorrow, but it'll create an environment where new doctors and former doctors and folks will say, you know what, maybe I do want to go back to New Mexico. Now it seems like a good place. I always loved it. And, you know, it's not going to happen overnight, but hey, New Mexico's getting it together as people like Keon who are advocating for and telling stories on our behalf.
Mexico. Yeah, I love it here. And I love that, again, it's one of those things that, you know, like I said, I know so many people who've left, and it's sad when I talk to people that I went to college with, whether they're dentists or physicians who came back here because their families are here. man, so many of them are like, they've been looking,
Yeah.
you know, even so many, I've had so many people tell me you should just get licensed in another state just in case. But that's not the point. The point is people deserve better. There's a broken system. There was, in my opinion, broken on purpose. Right. And I believe that that's wrong. It's wrong to profit off the pain and suffering of my neighbors, my community, the people in my state. That's wrong. And, you know, like I said, New Mexico, living here should not be a death sentence. It should not be a medical death sentence to live in New Mexico. And again, it's fixable. But political will is the only barrier. The craziest thing is changing 20 people would mean 2 million people would get better healthcare.
Yeah.
And that is crazy that those certain people, for their own profits,
A handful of people
they sit there and they say, oh, you know, we're here to protect patients.
We need to study it. We need to look at it. We need to evaluate this. It's like you've had years to do this.
Yeah.
Groups have taken it upon themselves, like Think New Mexico, which is one of the most reputable think tanks in New Mexico, with a nonpartisan angle to this, is that, hey, here's the data, here's what we're seeing, and here's the proof that we need to do these changes if we want to see the difference.
Yeah. You know, it's the people. It used to be, I used to say, oh, the people in rural New Mexico, but it's really everywhere. Everywhere in New Mexico, you're waiting for basic surgery, while, you know, the big city law firms are celebrating, you know, justice is what they're calling it. But again, in true justice would be joining with doctors, joining with the people in New Mexico to actually fix the system, which they're not doing. If they actually cared as much as they say they do about good outcomes, well, they would have better healthcare. They would go in there and say, you know what? I actually don't want anybody else to get hurt. We need to double the number of doctors in the state, right? We don't have the best. It's not even like, at this point, like I said, we're hemorrhaging doctors. At this point, we just need to stop that bleed.
Yeah, we just need to stop it.
Stop the bleed, and then try everything we can to rebuild it. And that won't happen that will never happen by some kind of compromise solution. Yeah. The solution is do what's right. Do what's right to protect people. Do what's right to help the people of the state get good healthcare. And then we can build on it, because there are good doctors. There are amazing doctors. You know, a friend of mine who's someone I look up to is a doctor in Roswell, he's an oncologist, and he has built a giant health system just on his own, right? And they have 2 rheumatologists, 2 endocrinologists, they have a neurologist, they have all these doctors, and that's just a home, like a local practice. And
he shouldn't be punished for his success,
right? I mean, and again, he's one of those people that just talking to him, and I see his patients, I see the care he gives, and the doctors he has. They give great care. They're passionate about treating people. They're not lawyers. They're not politicians. They can't go up to Santa Fe and spend a 60-day session sitting there,
waiting for bills to
happen,
and instead they pull it up in the middle of the night when no one's paying attention.
Right. You know, and if you so last 60-day session, one of the bills we tried to pass was just to put a cap on the amount of money an attorney could take from a malpractice lawsuit, right? So, and every attorney I talked to said, "Well, no, we already that's standard." Well, if it's standard, then why are we fighting over it, right? If you're saying the standard for you to take 30% or 33%, then why are you fighting so hard against this, right? And again, that was kind of a litmus test. It was a little bit of an exposure, like, hey, this exposes like, really, you don't actually care about this. You're trying to protect your profits, right? But what was interesting is that the session we tried, and for anybody who doesn't know, the legislative system, I don't know, man, I'm not involved in that. It just seems like a disaster. I don't know. Yeah. Maybe it actually works really well, and I just don't know. But it was, just getting to know all that stuff. Again, I'm a nobody. I'm just someone who cares, who's from here, who just wants it to be better. I'm not an attorney. I'm not a politician. I have no interest in politics. My interest is my children having the ability to have the same access to healthcare that anybody in the country has.
Just a high quality of life.
I want my children to be safe, my parents to be safe. But what was interesting getting involved in just to watch it, right? I didn't get involved. I watched it. I tried to get involved, tried to be a part of it, tried to make some kind of difference. And so they kept saying, "Oh, we're going to hear this bill, the one that capped, the lawyer fees." And it kept coming up, and they kept pushing it back. It kept putting up, "Hey, we're going to hear it today." No, they're not going to hear it. And 5 times I drove to Santa Fe from Roswell, and 5 times I drove home about halfway. One time I got there and then drove home. So 5 times I drove 3 hours. And I'm not trying to say, "Oh, like, woe is me." That's fine. When it actually happened, I got like an hour notification, so I couldn't even get up there. So I watched it. And it was exactly what I had been told would happen, right? And it's almost like people think it's like some kind of court trial. It's not. The people have already made up their minds who are up there. And when you look at the people who are up there, and when the chair of that committee specifically is their biggest funder is trial attorneys, you kind of already know where that's going, right? But what did the trial attorneys do? It was disgusting. It literally made me sick. They literally paraded people who had been harmed by medical malpractice, or they say had been harmed, and they probably were, and they should be made whole or the best we can.
Yeah, but now they're using them as pawns.
They literally, it was disgusting. It made me sick everybody I know who was watching that was literally, the response was like guttural, like, "That's gross. That's just wrong." People in wheelchairs, people who were harmed, they literally just paraded them out, and almost like, "Oh, this is so-and-so, and this is what happened to her. Okay, next. And this is so-and-so, and look what happened to her." And it was literally like that. Well, from what I understand, I mean, I was given an hour notice, and I don't live in a wheelchair.
Yeah.
Right? From what I was told was that they had literally just put all those people in hotels in Santa Fe
just waiting
for the entire session, just waiting to see if that bill was heard. And if it got heard, they would parade them all out. Yeah. And again, this is again, it's like, but they know the system. I don't know the system. Yeah. I'm just a guy practicing in New Mexico. I'm not a lawyer. I'm not a politician. I don't know how the system works. But what I do know is that the people here have a voice. And if your voice is not if the voice of the people is not, I mean, I can't imagine any person in New Mexico. I cannot imagine a single person in Mexico would be against a medical compact. If I told any person, "Hey, are you against having a world-class doctor consult on your case?"
Yeah.
No, I don't want that. No one would say that.
No.
So
they'd be like, "Yeah, absolutely."
Absolutely. So, and I'm not trying to there's no hidden agenda or anything. It's literally, do you want access to better healthcare? Yes.
We do not have a nonprofit that we're getting millions of dollars
for. No, this is literally medical compacts are just so common sense.
Yeah.
Even that, which is so common sense, and they still fought tooth and nail and blocked it.
Well, and it's unfortunate, Keon, that, folks like you who aren't involved in the legislative process much, you have your job that you do, but those of us who have been around the roundhouse have always said it's pretty easy to get jaded, and I wish more people saw what happens there, because I think we would see a big change in our electorate. People would really start saying, yeah, there's not a whole lot of accountability here. I need to reflect on who I'm voting for and what's happening, because when you go and you see stuff like that that's happening at our roundhouse, it leaves a bad taste in your mouth. And I'm sure you walked away like, man, is this how it is for
so
all
can you talk more about that? Because I literally, I don't know anything. And I walked in and I mean, again, I don't know much about all this stuff. I'm a total newbie to this. I was just a person that was like, I see a problem and I want to fix it. Right. And then, so I was sitting there walking in, I'm like, and I'm watching these bills go through and the way that they are like, and people were like, "Oh, well, so-and-so is in charge of assigning the bill. And if it gets assigned to more than X amount of committees, then it's definitely dead."
Yeah.
And they told us that from the beginning.
Committee assignments, it's usually dead.
So then you follow that back. And the person who's in charge of assigning those committees, trial attorney.
Yeah.
Right.
Yeah. The majority leader decides what committees it goes to. Hey, I don't like this. We're going to give it 3 committee assignments. We're going to slow it down.
You look at people like, Peter Worth, Joe Cervantes. I'm just calling them out because I'm not a politician. I have no political affiliation. Yeah. I'm a registered independent. Mimi Stewart, Katie
Duhigg.
Yeah. These people literally are trading money for blood.
Mm-hmm.
And there's no other argument there. Again, you can say, "Oh, we're trying to protect patients and all this stuff." Well, if you truly cared about that, you would make it better and not continue to make. And you're watching it. You helped create the system that made you money. There's no way a guy like Joseph Cervantes has not made millions off suing doctors. And of course, he helped build the system. The person that helped get us here, I don't remember his name. He was a trial attorney, and as soon as they built it, he left and went back to practicing. Right, left the legislature, went back to practicing. They created the system, and then they profited off of it. And again, you hear about things that are like, hey, there's causes you care about because you just, hey, I don't like it. I don't think it's wrong.
And he's also chair of the Judiciary Committee, which is very powerful. So anything that has to go through the legality checks and balances of the law goes to his committee, and he instantly controls when that bill's being heard, when he kills it. And if you stall it long enough, then it's killed as well. But yeah, it's definitely a problematic issue that we have. It's something I wish more New Mexicans see, but that's why we have the Chile Wire to talk about real news, real New Mexican stuff that's happening, and just bring awareness and truth. Like, let's just speak the truth of what is happening, and let's inform New Mexicans to be cognizant of who represents them, and if they are in fact representing their needs, their values, the issues. It's important to us. And so I am sorry that you had an unfortunate experience in the Roundhouse, but unfortunately, I think that's many folks who are trying to do good work and trying to, there's your advocates, and then there's your lobbyists and your interest groups. And unfortunately, the interest groups and lobbyists usually tend to win over, the advocates who really have something like deep down that's like, hey, this is just a really good thing to do. This is the right thing to do. Unfortunately, housing people in hotels for 2 months, you and I can't afford to do that. Right. So, but Keon, I want to say thank you so much for coming on the Chile Wire. I think I'm looking forward to getting you back on, because I think there's a lot more conversations that we're going to be able to have on this issue and other issues. And so,
and I think, unfortunately, this is going to be one of those things that's going to take time.
We're going to have to keep having the conversation.
But I also really appreciate, I personally, as a New Mexican, where do you get New Mexico news? You either hear it from people, right, or you hear it from newspapers, right? What I really appreciate, this is the first time I've ever seen a podcast that actually addresses issues we're having in New Mexico, right? We get so wrapped up in what's happening in other places. What's happening with gerrymandering XY places. Well, I want to talk about New Mexico, right? I want to talk about, we can talk about, Washington, D.C. all day, but how much does Washington, D.C. affect my children's lives, my parents' lives, my neighborhood, my, just the safety of my, in the life I live here. We need to be talking more about New Mexico.
The local issues.
The local issues. And that's what that's why I first found out, started watching, following your podcast and following you guys on Instagram and stuff, just because I was like, oh my gosh, someone's talking about New Mexico, talking about things that I care about, right? Whether it's schools, whether it's, water rights. I mean, I learned a lot about that stuff I didn't know, right? You hear everything's become so jaded that actually hearing from people who are just real people who care, I think that's really, really powerful. And so I really appreciate you having, taking the time to have me on the podcast. And like I said, I'm a nobody. I'm just someone who cares. But I hope that, what I hope is that more people will start to see and understand what you and I have seen, right? And we can maybe, if we can't change the politicians, maybe we change their minds, and really,
or change their constituents' minds,
right? I mean,
exactly. People got to remember our statesmen and stateswomen work for you. Like they shouldn't be held as celebrities or politicians. Like, their job are to be our public servants, and we got to hold them accountable if they're not doing what's best interests of New Mexicans and their constituents. There's a problem there, and they work for us, and we got to remember that. Like, they don't work for, we don't work for them, and we have an expectation if we send them to Santa Fe that they're doing the right things, that they're not gaining from the own system that they've created. And we've seen that, trial lawyers have utilized now the legislative process to look out for themselves. And, on here on the Chile Wire, we'll tell you, we believe in capitalism. We love free markets, but not on the backs and the expense of hardworking people. Capitalism is one of the best economic systems ever. America is one of the greatest, and New Mexico's, I will tell you, the greatest state of America. But, to do it on misinforming people and, doing it the wrong way, we have problems with that. And we
Yes.
want to address that on the Chile Wire. And Keon, I just want to say our team here is thankful for you, for
No,
the
thank
kind
you guys.
words.
Yeah.
And that's why we got this started. We just wanted to have, we're no buddies as well. We just
No,
want to
no.
have a conversation.
Again,
and-
we're all part of the same. Again, we're all on this. From my see is like we're all on the same team. It's again,
Yeah.
this is all the issues facing New Mexico are not partisan. It's so easy to get wrapped up in, Democrat, Republican, red.
and we're more
blue,
alike
all
than
this
we are
stuff.
different. Like,
Of course, because we all face the same problems. We all face the same things, and at the end of the day, we all love green chili. We all love all our traditions.
sometimes you
love
like
the balloons.
red, depending
Yeah,
on the
it's just,
meal.
some or you don't like Christmas, but all those things. It's the reality is, it's so polarizing if you watch everything happen on a national level.
Yeah.
But in reality, I don't think that these topics are not.
They're not
partisan.
polar. No,
they're
not.
just like, look, this is apolitical. Crime is apolitical. Healthcare is apolitical. Education is apolitical. These are things that we should just all come together and say, I don't care what party you are, we need better.
Well, and I'll tell you, even the polarizing issues, and I've said this to many people, and I'll say here live on air and everything, is that those polarized issues, both parties are responsible for those issues
Sure,
because they've
absolutely.
all had chances to fix it.
Right.
They won't because they're great talking points. They're great opportunities to use certain issues as pawns, whether it's immigration, border security, foreign relations, whatever it may be. The Democrats have had a crack at it at the federal level where they controlled all levels of federal government. The Republicans have as well. And at the end of the day, if it's an issue and it's like, okay, we could have fixed it, but we didn't, then, you're part of the problem. And that's just it. Those polarized issues, I think, are not a reflection of who we are. And I think I'm glad you made that point because that's something that frustrates me as well, is when I hear that, Democrats talk about immigration and talk about all this reform. And, you had the Obama years where they had all three branches of government.
Right.
They didn't fix it.
Right.
So if they really, really wanted to fix it, they would have.
Right.
But here's the problem. They don't want to fix it because then they run out of talking points to get them elected.
Right.
And that's the problem. And so, Keon, want to thank you very much for coming on the Chile Wire. We look forward to having you again. And please keep us informed. No, thank you. Thank you for getting involved because honestly, it's individuals like you that really make the difference. We bring the microphones to give you a platform to talk about it, but it's you getting involved, telling the stories of how it impacts you, but the deeper is that how it impacts your family and the opportunities that exist for them.
And what I would love, and I think it would be great, is if your listeners and viewers have the opportunity, if you're from New Mexico and you have the doctor shortages and the lack of healthcare and the healthcare system has affected you, like comment about it. Tell us. We want to share with us. If you're willing to share, I want to hear what you're going through. Right. And I want to empathize with you. I want your problems to be my battle cry,
Absolutely.
because that's how we make change and that's how we connect and try to make our state better.
Absolutely.
So.
Keon, thank you for that.
Yeah,
Keon is an avid follower of the Chile Wire. So if you comment on this, on our videos, he'll be sure to respond and reach out to you.
Absolutely.
And thank you all for tuning in this week to the Chile Wire. If you haven't subscribed yet, follow us now on Instagram, Facebook, and all social media platforms. And you can find us also on YouTube if you're interested. So Keon, thank you very much.
Absolutely.
We wrap it up. And by the way, just last note, we didn't coordinate. We didn't
coordinate. We should have though. We should. If you had told me about the white pants, I would have worn them.
I should have said something. Next time, we're going to get you back on. We'll make sure we match. Well, everyone, that's it for this week. We'll see you next time on the Chile Wire.